Hi, my name is Megan. I'm a nursing student and I'm going to be performing your head-to-toe health assessment. So first I'm going to wash my hands. While I'm doing that, what's your name? Can you tell me your name?
Samantha Joyce,
Okay, and what's your date of birth?
12/31/1996.
Okay, and do you know what today's date is?
Yes, it is November 15th, 2016.
Okay, perfect. So the patient is alert and oriented ×3. She appears to have good behavior, good expression, relaxed. All right, high level of consciousness. So the first thing that I'm going to do is a skin assessment. So I'm just going to kind of feel around your skin so it feels warm, even temperature, pinkish skin tone, no lumps or lesions. Do you have any tenderness? Any pain? Okay, I'm going to check for pitting edema. Okay, no edema. I'm going to pinch your clavicle right here and just check for skin turgor. So good hydration. Yeah, no lumps or lesions. So we're all good. Then I'm going to move on to your head. So sorry, I'm kind of step up here. So normocephalic. No lumps or lesions. Even hair distribution, good hair texture. No infestations or anything like that. So that's good. Then, sorry, I messed up here. I am going to check for your cranial nerve 7. So can you smile real big, frown? Can you puff out your cheeks? Good. So bilateral symmetry, facial nerve, cranial nerve 7 is intact. And I'm going to palpate your temporal artery. So 2+ bilaterally, so that's good. Then I'm going to check your temporomandibular joint, so if you could open your mouth. Good, no clicking. And then I'm going to check cranial nerve 5, your trigeminal nerve, by, I'm going to try and pull down on your chin, and then I'm just going to test your strength. Okay, good. I don't know. Yeah, it's still going. Sorry about that. So now I'm going to place this on 3 different spots, and you just tell me when you feel it, because this is for your trigeminal nerve. No. Good, so your trigeminal nerve is intact. Okay, so next I am going to check your eyes. So I'm going to check your visual acuity. So I am going to ask you to read the, cover your eye, and then read the small sign you can.
DEFPOTEC.
Okay, can you cover your other eye?
DEFPOTEC.
All right, and then read it with both.
DEFPOTEC.
Okay, good. And then I'm going to do the confrontation test to further confirm that your, I'm just going to keep this, your cranial nerve 2, optic nerve.
Okay.
So I'm going to cover this, and then you just tell me when you see from the periphery.
Okay. No. 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 No.
Okay, good. So optic nerve is intact. Next, I am going to check your extraocular muscles, so cranial nerves 3, 4, and 6. So I'm going to first check your the 6 fields, cardinal fields. So just follow my gaze, and we're going to make sure there's no nystagmus.
Okay.
Good. No nystagmus. Next, I'm going to check for your corneal light reflex. I don't actually know how to turn your phone.
You just press right here.
Oh, look at that. So I'm just going to make sure that the light reflection is in the same spot on both eyes. Okay, good. So cranial nerves 3, 4, and 6 intact. Next, I'm going to pull down your eyes and check your conjunctiva.
Okay.
So they're nice and pink. Your sclera is white. Your irises are round and blue. Your pupils are 4 millimeters, which is normal. I'm going to check your cornea. Okay, good. No abrasions, clear, no cloudiness. Make sure this is still on. Okay, and then I'm going to check your pupils. Check for perla. So your pupils are round, reactive, equal. Pupils equal, round, reactive to light, and then I'm going to have you look at that corner, and then I'm going to have you look at my finger. Now. Okay, pupils converge and constrict, so combination, so perla. The next thing I'm going to check are your ears, so I'm going to, thank you.
Mm-hmm.
Okay, so I'm going to check that they're bilaterally symmetrical, same size, no redness or tenderness or swelling, auditory meatus. I'm going to get my pen line again. Okay, there's serum present, but no redness or other discharge bilaterally. Good. I'm going to check the auricle and push on the tragus, and then you tell me if that hurts.
Mm-hmm.
No? Nope. Okay. Then I'm going to check for your cranial nerve 8, so the auditory nerve. So I'm going to do the whisper test. So I'm going to push on the tragus, and then I'm going to say 3 things, and you just repeat them back to me. Okay.
5B6.
Okay, I'm going to go to the other side.
5B6.
Okay, so cranial nerve 8 is intact. Next, I'm going to move to your nose. So I'm going to get this again. So your nose is midline, symmetric. I'm going to check for patency. I'm going to ask you to occlude one nostril and then sniff, basically. Good. Okay, and then I'm going to look at your nose. Good. Normal. Mucosa. No discharge, anything like that. Next, I'm going to move to your mouth. So your lips, no lesions, even coloring, no cracks, anything like that. Good hydration. Next, I'm going to move to your teeth. So good. Do you have any toothaches or anything like that? No? Okay. Appear to be good. Can you open your mouth? I want to check your buccal mucosa. Good. Pink. Hydrated. I'm going to check your tongue, tonsils, and uvula. So if you can just stick your tongue out and then move it side to side. Good. And then say light, tight, dynamite.
Light, tight, dynamite.
Perfect. And then I'm going to check your tonsils. Okay. 1 plus. And then I'm going to check your uvula. So can you say ah? Oh, sorry. I'm so sorry.
Okay.
Can you say ah?
Ah.
Okay, good. So uvula is midline and mobile. Okay, so we checked cranial nerves 9, 10, and 12. Okay. Next thing I'm gonna do is move on to your neck. So I'm going to check your lymph nodes first.
Okay.
So I'm gonna do and just tell me if you feel any tenderness. I'm gonna be checking for hardness or pain or anything like that. Swelling.
Okay.
Lymphedema. Preauricular. Postauricular. Occipital. Submandibular. Submental. Jugulo-digastric. Superficial cervical chain. Deep cervical chain. Posterior. And then supraclavicular. Good. Okay, so no swelling. Any pain?
No tenderness.
No tenderness. Okay, I'm going to check your thyroid now.
Okay.
So I'm going to check for, make sure it's midlined, no deviation. So I'm going to have you turn that way, and I'm going to deviate it this way. Will you swallow for me? So non-palpable, no nodules. I'm going to do the same thing on the other side. I'm going to move your hair if that's okay. Ooh, can't really get there. Okay, swallow. Oh, you have no nodules.
Sorry.
If you did have an enlarged thyroid, I would use my bell and listen for breweries, but you do not have an enlarged lymph node, or thyroid, sorry. Okay, and next I'm going to check the range of motion of your neck. So, sorry, just want to make sure that's still recording. So if you can side to side, rotate, okay, chin to chest, and then up, look up, Good, thank you. And then I'm going to push, and you push against me, so good strength. Good, and then I'm going to push down to check for cranial nerve 11, and then you push up, okay? And then I'll push, you push up, okay. Good, so cranial nerve 11 is intact. All right, the next thing I'm going to do is move on to your posterior chest. So first I'm going to note that your AP transverse ratio is good. It's 1 to 2, as it should be. No barrel chest. It's oval. Okay. Next, I'm going to check for even expansion, symmetrical expansion. So I'm going to put my hands here at T9 and T10, and I'm going to ask you to take a deep breath. Okay, so my hands move symmetrically, so even expansion. Next, I'm going to check for her lung sound. So I'm going to do bronchiovesicular and then vesicular. And I'm going to listen for any abnormal sounds like wheezes or crackles. Okay. Just take a deep breath. You feeling okay? Not dizzy yet?
Yeah.
I always get dizzy when I breathe. Okay, no adventitious sounds. Next, I'm going to have you turn around, face me, and then do the same thing, but then I'm also going to test for it, or listen for your bronchial lung sounds. So that's why your larynx and trachea. So just take deep breaths again, but tell me if you get dizzy. You okay?
Mm-hmm.
Okay. You good?
Mm-hmm.
Giving it all that carbon dioxide. Okay, so no adventitious sounds, no wheezes or crackles. Okay, next I am going to be checking your heart. So the first thing I'm going to do is listen at the base of your heart for murmurs.
Okay.
So if you can kind of like lean forward and then take a deep breath and hold your breath out.
Okay.
And then I'm just going to listen at the base of your heart with my diaphragm. Okay, no murmurs. I'm going to have you lay down.
Okay.
Okay, I'm going to palpate your carotid arteries one at a time.
Okay.
Okay. 2 pulse bilaterally. Good. I'm gonna listen for bruise, but I'll do this first. I'm gonna raise the head of the bed. I can. There. Okay, and I'm gonna be checking for jugular vein distension.
Okay.
Yeah, if you can turn. Okay. So I can see it, and then at 45 degrees, it should disappear. Okay, good. I can just. I'll just have you sit down, and I'll put this back down. Okay, I'm gonna be listening for bruise with
sorry.
the bell. Oh, you're fine. No, do you want to sit up, please?
Oh.
Sorry. I'm going to be listening to your carotid for bruise. I'm going to move it this way again. Okay. Have the bell. If if you can exhale again and hold your breath, and I'm going to do one side at a time, and you can breathe in between.
Okay.
Okay. Okay. Okay, no worries. Next, I am going to listen to your heart sounds. So I'm going to listen to aortic, which is the right second interspace, the pulmonic, the left second interspace, Erb's point third left interspace, the tricuspid, which is the left sternal border, and the mitral, which is the midclavicular fifth intercostal space. S1 is best heard at the apex, S2 is best heard at the base, and so I'm going to listen with my diaphragm and then with my bell. Sorry, you're good. Okay, let's go with the bell now. Sorry, I messed up there. Went out of order. Okay. Next, I am going to listen for your rate and rhythm. So I'm just going to have you lay down, and I'm going to have you turn to your left side, and then I'm going to count for 30 seconds, listen for 30 seconds, and then if it's irregular, I would go to 60 seconds. Okay. That's 60, right? You're normally like on the lower side.
Anywhere between that and like 80, something like that.
Okay, well, it was regular.
Okay.
I'm going to have you, sorry, I'm going to have you stay on that. I'm going to check for S3 and S4 sounds. Take a deep breath, hold it out. Okay, no abnormal sounds.
Awesome.
You have a healthy heart. Good job. Okay, the next thing I'm going to do is move on to the abdomen. So I'm going to first inspect it. And so, oh yeah, sorry. So it is symmetric, bilaterally, flat contour. The umbilicus is midline. I don't know why this keeps going. Okay. Next thing I am going to do is, I don't know why I put my stethoscope down because I'm going to auscultate your abdomen. I'm going to listen to your bowel sounds. I'm going to start in the right lower quadrant and then work my way around.
Okay.
Okay, and if I didn't hear anything, I'd listen for 5 minutes, but I hear your bowel sounds. Okay, so normal active times 4. Okay, next thing I'm going to do is percuss. So I'm just going to be listening for tympany over like the stomach and the intestines, and then dullness over the organs. Next, I'm going to be palpating. So I'll do light palpation first. So just tell me if there's any tenderness. Okay. 2 hands. Sorry if my hands are cold. Okay, and then when I do deep palpation, I will be feeling for any enlarged organs.
Okay.
And any pain. So tell me if there's any pain. I'm going to palpate your liver by like hooking my hands under, and then I'm going to have you inhale as deep as you can, and then exhale.
Okay.
Okay, no enlarged liver. And then I'm just going to stay on this side. Again, tell me if there's any pain. No enlarged spleen, kidneys. Okay.
Awesome.
Abdomen is good. The next thing I'm going to do is your lower extremities. Okay, so you can just stay there.
Okay.
I'm going to make sure this is moved. So I'm going to note, I already noted no edema, so no lumps or lesions again, and I'm going to check for your pulses. So I'm going to do the anterior tibial. Cannot see me. Yeah. Okay, 1 plus bilaterally, and then okay there. 1 plus bilaterally. Okay. So the next thing I'm going to do is your musculoskeletal system. Sorry, I couldn't remember for a second. Okay, so we're gonna do. Do you want to put your shirt back on? You can't have your
Sure.
Okay, so we're gonna test range of motion and strength. So first, we're gonna start with your shoulders.
Okay.
So if you can, and I'm just gonna like push against you to test for strength.
Okay.
So you can extend or flex, and then extend. Okay, good. And then abduct, adduct. Okay, good. Internal rotation, external rotation. Okay, good. Next, we're gonna do your elbows.
Okay.
So flex, extend. Good. Supination, pronation. Good. Next, we're going to do your hands, so your fingers. So flex, extend. Good. And then touch each finger to your thumb. Good. Perfect. Okay. Next, we're going to do your hips. So I'm going to have you flex and extend your hips. Oh, sorry. Okay, good strength. Okay, and then you're going to do external rotation and internal rotation. Sorry, that's external, and then internal. Good, and then we're going to do your knees. Oh, we're going to, sorry, thank you. We're going to do abduction, and then adduction. Abduction, adduction. Okay, good. Next, we're going to do your knees.
Okay.
So we're going to have you flex and extend your knees. Extend, flex, extend. Okay, and then can you just see if this can...
I'll walk this way.
Okay. Good. So I'm just watching your gait. Good. And then can you bend a little bit for me? So good for your knees. Okay, and then we're going to do your ankles and feet.
Okay.
So we're going to test your dorsiflexion and plantarflexion. So dorsiflexion. Okay, plantarflexion. Okay, dorsiflexion. Plantarflexion. Okay, and then inversion and eversion. And another one. Okay, good. So your range of motion is good. Strength 5+, and then we are going to test neurological function. So I'm going to just place this on different parts of your body, and you just tell me like when and where you feel it. Okay?
Where? Yeah. Okay.
Yeah. You can close your eyes.
Okay. Face. Arm. Hand. Arm. Hand. Leg. Leg. Foot. Foot.
Okay. Perfect. Next, we're going to test the cerebellar function of your upper extremities.
Okay.
So I'm going to have you touch your nose and then touch my finger.
Okay.
We're going to do it with each one hand. Okay, other hand. Okay, and then we're going to do rapid alternating movements. So just go like this. Okay, good. And next, to test for lower extremity cerebellar function, I'm going to have you run your heel across your shin.
Okay.
Down your shin. Okay, perfect. Next, we are going to test your deep tendon reflexes.
Okay.
So, make sure this works again.
Would you like me to sit down?
Yeah.
Okay.
Good. So I'm going to start at your biceps. Okay. I'm going to note this as plus. Your triceps, just have it hanging down. Actually, not that one.
Mm-hmm.
Okay. Brachial radialis. Okay. This one I can. Okay. Then I'm going to do your patellar and Achilles. Yours!
They're good.
Okay. That one worked. It just goes into my hand. That one feels weird. Damn it. Okay. So your deep tendon reflexes were all 2+. Sounds good. Next, I'm going to check the range of motion of your spine.
Okay.
Actually, I'm going to do Romberg's test first.
Okay.
Sorry. Tricked you there. Okay, so for 20 seconds, I'm going to have you close your eyes and stand still.
Okay.
And just try and like stay as still as possible.
Okay.
And I'm going to make sure you don't fall.
Okay.
Okay, we're going to call that good.
Okay.
Okay, so good. And then the last thing we're going to do is check your range of motion of your spine.
Okay.
So I'm going to have you flex and extend, lateral left, lateral right, rotation. Okay. I believe that's all. Okay, thank you so much.
Yeah, thank you.